start by providing some context about the importance of data for health systems and describe some of the challenges that Mozambique and many other developing countries face. I'll then outline our project's response to the situation, specifically highlighting the processes we used for data quality improvement. Lastly, I'll review some of the results that we've seen on our project so far and conclude with some thoughts on why improved data governance and oversight can contribute to building stronger health systems. Governments around the world have recognized the importance of data management for increasing the quality of public health services. Systematic data collection, analysis, and use can help to identify and address both site-specific and sector-wide opportunities to improve service delivery and health outcomes through evidence-based decision-making. However, in Mozambique and many other resource-constrained countries, health data has been weak across all levels of the healthcare system. Incomplete, inaccurate, and unorganized data flowing from health facilities up to the central level has inhibited the ability for health sector leaders to identify appropriate actions for improving health services and operations. Unfortunately, attempts to improve data quality at the lower levels has been overwhelming in Mozambique, given that resource-constrained systems rarely have the staff, time, or capacity, or energy for that matter, to use data for course correction and service improvement. One of the slides that I have gives a better picture of some of the challenges that are faced in Mozambique. To give an idea of how constrained the health workforce is there, the WHO reported in 2011 that there were 64.5 medical doctors and nurses per 100,000 of the population, which is far below the minimum acceptable health worker density threshold of 230 per 100,000. The shortage is further compounded by imbalanced distribution of personnel across regions and also between urban and rural areas. You can imagine that when so few are serving so many, that data management is not exactly at the top of their priority list. This can have major implications for health outcomes, though, because facilities and the health system at large cannot meet the needs of the population. It can't identify sources of inequity in healthcare provision or utilization, or improve patient care without good data. In response, Deloitte assisted Mozambique's Ministry of Health to develop and adopt a data quality and performance monitoring tool and feedback process. The process, which is referred to locally as retroinformação, meaning retro information or back information, is supported by an easy-to-use Excel tool that tracks the timeliness, completeness, and accuracy of health data. Once populated, the tool is then used to provide monthly feedback on data quality to all of Mozambique's 11 provinces. I also have a graphic on one of my slides that I can walk through and then go through again once we have a visual. The left side represents the way that data traditionally flows through the health system, where it starts at the health facility level and then moves up to the district level, provincial level, and then is finally consolidated at the central level. And the right side shows how the retroinformação tool has health authorities at the central level reviewing data that comes through Mozambique's electronic health information system called the Módulo Básico, or the basic module, very basic. And they send their feedback down to the provinces, who then send their feedback down to the districts, and then so on to the health facilities. The participatory process ensures that all levels of the health system are held accountable for data quality and performance. So, what kind of results are we getting from using this tool? Since it was developed in 2012, the Ministry of Health has seen impressive improvements in the timeliness, completeness, and accuracy of provincial and district level reporting. Compliance with report submission has steadily improved over the last 3 years, from 31% in December of 2012 to 69% this past June of 2015. We're expecting to see the highest yearly percentage increase since implementation this coming December. Additionally, central government has doubled the number of key performance indicators that they're able to review, and these indicators measure service delivery outputs for a number of politically significant programs, including HIV, malaria, maternal and child health, and family planning. among others. We've also seen provinces improve to an average 5-day turnaround between the time that they receive recommendations from the central level to when they're able to update the data and send corrections back through the Retroinformação tool. The Department of Health has fully adopted this process and is working to expand the tool to all levels of the health system. In fact, after receiving consistent feedback, many provincial health authorities are now taking it upon themselves to collect missing data and correct inaccurate entries, and are using the Retroinformação tool and process for district health facilities as well now. Another key result is that there are imminent plans to integrate Retroinformação with the SISMA, which is Mozambique's new electronic health information exchange that's supposed to be coming out in January of 2016, demonstrating the promise of continued improvements to data collection and quality for population health. And lastly, due to strengthened data quality at all levels of government, Retroinformação data is quickly becoming the preferred source of reliable health data and has been used to develop the country's key operational plans and frameworks for the health sector. So to conclude, I'd like to leave you with just a few takeaways. First, inadequate health information is a major challenge. The problem we face today is that weak health information systems pose a problem for governments who want to use reliable data to improve the health sector. Second, the Retroinformação tool provided a working solution to address this challenge. The project addressed this by introducing a feedback process from the central level downward to improve data governance and oversight. The tool has empowered central level control over lower level reporting. It's increased the reliability of data submitted, and I think most importantly, it's increased ministry confidence in data-based decision-making for the health sector. Third, this intervention can easily be scaled up and applied more broadly in many types of settings. We learned from our project that introducing systematic data transparency and feedback mechanisms is a cost-efficient, easy, and effective way to increase participation from all levels of government. Tools such as Retroinformação could be replicated across many resource-constrained settings. It may also just be the key to increasing reliability for evidence-based decision-making and improving health outcomes. Thank you.